COVID-19 public health crisis has changed our country and our city in ways we could have never imagined and continue to assess. Over the past 2 months, we have aggressively worked to save lives and blunt the progression of this community spread of the coronavirus. And we are seeing positive results, but we are not yet out of the storm. Let me start off by saying this virus is not currently under control. And let me repeat that. This virus is not currently under control. Today, the Houston Health Department has announced 107 positive cases for a total of 2,923. Fortunately, today, we are not announcing any new deaths. So the death total in the city of Houston remains at 34. The stay home, work safe order has made a difference. It has saved lives, along with social distancing and face coverings. And just as we are starting to see some progress in flattening the curve, many are urging that we immediately reopen the economy. I want people to understand that many in the medical community are saying that Houston has yet to reach the peak. And once we are there, we must be very measured on how we proceed to avoid a resurgence of the virus. And I know I echo the sentiments of Dr. First. I too want to reopen our economy. Follow the guidance of medical experts. And in the precursor to opening the economy and how we reopen the economy is testing, widespread. As we began the conversation, today I'm proud to announce that former Shell Oil President Marvin Odom has agreed to serve as the City of Houston's COVID-19 Relief and Recovery Czar. And let me just say from the beginning, Marvin, let me thank you on behalf of this city for agreeing to step up again. Marvin is no stranger to working on disaster recovery, as he served previously as Houston's Chief Recovery Officer after Hurricane Harvey. From all sectors, he received rave reviews for the team he assembled, the task forces he created, and the collaboration that he forged. And throughout his service to the people of Houston, Marvin was instrumental in working with local, state, and federal partners to secure funding and reform policies. He broke new ground in disaster recovery, and he helped move Houston forward to become a more resilient city. Quite frankly, I have seen no person better received by all members of City Council in their work under Marvin. In his new role, Marvin will work with business leaders, Chamber of Commerce, employee groups, nonprofit organizations, and members of my executive team to develop a plan to safely and responsibly move Houston forward. Marvin will have broad discretion to identify solutions and create strategies to safely and responsibly restart Houston's economy and make sure we address the challenges facing our vulnerable and at-risk populations and communities. All the above does not stop with Houston's geographical boundaries. Judge Hidalgo and I have had numerous conversations on how to move both Houston and the county forward. Marvin will work directly with the county's designated representative, in this case, the Representative Amanda Waller, who I know very well, to forge a cohesive strategy and plan for Houston-Harris County. Reopening must be done in phases, and there are 4 critical issues I want Marvin to focus on as he moves forward. Number 1, how to restart the economy in Houston. Before we send people back to work and reopen businesses, we must also have robust, ubiquitous testing. Business leaders should have a plan for testing and ensuring the safety of their employees. And in a few minutes, we will hear how one such company is leading in that area. Houston's 2 testing sites have the capability to test 1,000 people per day. Houston needs to test 3,000 to 5,000 people per day to get a better sense of where this virus is and the extent of the community spread. Once we know where it is, we can isolate it and better protect the general public. 2, strategies and adjustments if we see increase in positive cases. We also must consider what happens if we reopen the economy, people go back to work and their regular routines, and we start to see an increase in the number of positive COVID-19 cases. Part of Marvin's charge will be creating a plan in case Houston has a resurgence of COVID-19, and contract tracing is a major part of that strategy. 3, protecting at-risk vulnerable populations. Marvin will work with a task force I have already appointed. It is led by the directors of Complete Communities, Education, Faith-Based Initiatives, and Resiliency. And they will identify issues and find collaborative solutions for vulnerable communities and populations within our society. As we restart and move forward, we must ensure that those populations are not left behind. And 4, how do we prepare for the next pandemic viral attack? Houston is a resilient city with a resilient community, but I have also charged Marvin with developing a plan to prepare the city for the next pandemic or viral attack. And he will be working with Marissa Aho, the city's chief resilient officer, and will develop an addendum to the Resiliency Houston plan that specifically addresses COVID-19 and the shocks and stresses associated with this crisis. Harvey created a unique set of challenges. So does COVID-19. And I can think of no better person to lead our recovery effort than someone who is already familiar with the huge challenges of Houston's past. And now I'm pleased to introduce the Chief Resilient and Relief Czar for the City of Houston, Marvin Oakley.
Well, good afternoon, everyone, and thank you, Mayor. I think the good news here from the very start is you're going to see a lot of commonality between your comments and mine. It's good that we're already on the same page. I also want to say thank you to all the Houstonians who have taken this crisis so very seriously and heeded the advice of our extraordinary public health officials. It's because of this that we are able to be here today to talk about the steps necessary to reopen Houston. I also appreciate the leadership from the mayor and the county judge during this difficult time, including the focus and the deep understanding on the importance of returning Houstonians to work. To be clear, this is about keeping people safe and getting people back to work and re-energizing our economy. We have been charged with completing the plans that will reflect that delicate balance between the need to return to work and the necessary vigilance required to keep people safe and healthy. As we put these plans together, there are some guiding principles that will steer us, and I wanted to share 3 of those with you today. The first is that we will act as quickly as possible because we understand the desire and the need to do so. Our speed will ultimately depend on a number of factors, like testing and contact tracing, to confirm our return is meeting our criteria of keeping people safe. Second, our approach will be inclusive. We will bring together a broad group of stakeholders to ensure that this plan reflects all Houstonians. We will need social services, nonprofits, civic and faith leaders, education, and importantly, the business community, all to rally around this plan. This plan will prioritize the most vulnerable populations and their particular challenges. Taking into account, for example, individuals that might not be able to buy a mask or see a doctor, just as one set of examples. Fortunately, as the mayor mentioned, he's already kicked off a task force, so we're already up and running in this respect. Access to the business community will be through channels such as the Greater Houston Partnership, the Houston Hispanic Chamber, the Greater Houston Black Chamber, and the Asian Chamber. It will also include the views of small businesses that aren't necessarily plugged into those organizations, but make up a large portion of our economy and the employment in our city. The third guiding principle I wanted to mention today is that we are here to collaborate with everyone that I just mentioned, and first and foremost with the county. We will work closely with the state, and we will work with the federal government where appropriate. The key point here is we don't want to duplicate work or waste any time. Rather, we'll be tailoring well thought through frameworks. Think of a framework like it was put forward by the governor here recently. But we'll take those frameworks and we will account for the uniqueness of Houston and Harris County, including our position on the infection curve, and adding the necessary details for local implementation. I want to take a moment now and just mention a few characteristics of what I would consider a successful reopening plan. And the first is one that the mayor mentioned, and that is testing and contact tracing. Now, no surprise here, and no surprise that that's a key topic, and also we're fortunate in Houston that we're blessed with an extraordinary medical community that's already front and center and working on these issues. We all know that this is the very basis of successfully reopening our economy. In addition to the capacity questions that we have to address, we also will need to think through how testing can be strategically applied to support our return to work plan. I think of this as testing at the right place, at the right time, and at the right frequency. Now, this will be critical to developing the confidence that we all want and we all need. The confidence that our reopening steps are working the way that we intended. Now, contact tracing, while not nearly as far along as testing, will need to be an area of focus as well, to ensure that we do not inadvertently create new hotspots of infection. I will emphasize again that it is this testing and tracking, along with the safety and distancing protocols that are in place and lagging indicators such as the number of hospitalizations, that will be required to build the confidence that our reopening plans are working and that we're not just hoping for the best. Another and second key aspect of a reopening plan is the ability to identify problems early and make adjustments. And you heard the mayor refer to this. Now, this is clearly related to the testing and the tracking that we've talked about, but my point is that this requires forethought and transparency regarding how we will respond to negative indicators if they surface. So we'll include that in our planning scenarios. A third aspect is that the federal government is